Influenza, commonly known as the flu, is a contagious respiratory illness caused by influenza viruses. It can lead to mild or severe illness, and in some cases, complications that result in hospitalization or even death. Every year, millions of people get the flu, and it can spread rapidly, especially during the colder months when people tend to stay indoors. Understanding what influenza is, how it spreads, and how it can be prevented and managed is critical in minimizing the impact it has on both individuals and communities. Hi, I'm Dr. Knapp, family medicine physician here to bring you medical information so you can take control of your health and make the most of your doctor visits. The flu primarily affects the nose, throat, and lungs. While the virus can infect anyone, certain groups are at higher risk of developing serious flu-related complications. These groups include young children, people over the age of 65, pregnant women, and those with chronic health conditions like asthma, diabetes, or heart disease. For these individuals, catching the flu can lead to complications such as pneumonia, bronchitis, sinus infections, and worsening of chronic illnesses. For healthy adults, the flu can still cause severe discomfort, requiring days or even weeks of recovery. Symptoms of influenza can come on suddenly and may include fever, chills, muscle or body aches, fatigue, cough, sore throat, runny or stuffy nose, headaches, and in some cases vomiting and diarrhea. Not everyone with the flu will have all of these symptoms, and in some cases people infected with the flu virus might experience a mild illness that resembles a common cold. However, it's important to remember that even mild cases of influenza can be contagious. The flu spreads through droplets made when people with the virus cough, sneeze, or talk. These droplets can land in the mouths or noses of nearby individuals or be inhaled into the lungs. Additionally, flu can be spread by touching surfaces or objects that have the virus on them and then touching one's face. Given how easily the flu spreads, prevention plays a key role in reducing the overall impact of the flu season. The most effective way to prevent influenza is by getting the annual flu vaccine. The flu virus mutates rapidly, meaning that each year the strains of the virus circulating in the population may change. The flu vaccine is updated annually to protect against the most common strains expected to circulate that flu season. For most people, getting vaccinated greatly reduces the risk of catching the flu and can make the illness less severe if they do get it. While the vaccine isn't 100% effective, it's the best defense we have against influenza. The flu vaccine is recommended for everyone 6 months of age or older. People in high-risk groups should be particularly vigilant about getting the flu vaccine, as the flu can lead to more serious health outcomes for them. The vaccine is available in different forms, including a standard shot, a high-dose shot for older adults, and a nasal spray for certain individuals. It's important to consult with a healthcare provider to determine which type of vaccine is appropriate for you, especially if you have underlying health conditions or concerns about allergies. Of note, the flu vaccine is safe in those with egg allergies. In addition to getting vaccinated, there are other ways to reduce the risk of contracting or spreading the flu. Regular hand washing with soap and water is crucial, as is using alcohol-based hand sanitizers when soap and water aren't available. Avoiding close contact with people who are sick and staying home if you're feeling unwell are also important measures. Since the flu can be spread by touching surfaces contaminated with the virus, disinfecting commonly touched surfaces like doorknobs and phones can help reduce transmission. If you do contract the flu, it's important to know how to manage the illness and take steps to avoid spreading it to others. Most people with the flu recover on their own with proper rest and care. Staying home from work, school, or social gatherings is critical to prevent spreading the virus. The flu is highly contagious, especially in the first 3 or 4 days after symptoms appear, so isolation during that time can significantly reduce the risk of passing the virus to others. Treating the flu at home involves several key steps. First and foremost, rest is essential. The body needs time and energy to fight off the infection, so taking time off to allow your immune system to do its job is vital. Staying hydrated is also important because flu symptoms like fever, vomiting, and diarrhea can lead to dehydration. Drinking plenty of fluids, including water, herbal teas, and clear broths, can help keep you hydrated. Over-the-counter medications such as acetaminophen or ibuprofen can help manage fever, headaches, and muscle aches. These medications won't cure the flu, but they can make the symptoms more bearable. It's important to follow the dosage instructions and consult a doctor if you have any underlying health conditions or are taking other medications that could interact with these treatments. In some cases, a healthcare provider may prescribe antiviral medications to treat the flu. These drugs can help reduce the severity of the illness and shorten the duration of symptoms, particularly if they are taken within the first 48 hours of symptom onset. Antiviral medications are especially beneficial for people at high risk for flu-related complications, such as older adults, young children, and individuals with chronic health conditions. It's important to note that antibiotics do not treat the flu, as influenza is caused by a virus, not bacteria. For high-risk individuals or those who develop severe symptoms, seeking medical care is important. Complications such as pneumonia or bronchitis may require additional treatment, and hospitalization may be necessary in severe cases. Signs that someone may need medical attention include difficulty breathing, chest pain, persistent high fever, confusion, or severe dehydration. Children in particular may exhibit different signs of distress, such as fast or labored breathing, bluish skin color, or a refusal to drink fluids. In these cases, it's important to seek medical help immediately. Preventing the flu from spreading within a household is another key aspect of managing the illness. If someone in your home is sick, it's a good idea to try to keep them isolated in a separate room, if possible. This helps to minimize contact with others and reduces the chance of spreading the virus. Caregivers should wear masks and wash their hands frequently when caring for someone with the flu. It's also helpful to regularly clean and disinfect surfaces that the sick person may have touched, such as door handles, light switches, and bathroom fixtures. Even though flu season happens every year, it's easy to underestimate just how serious the flu can be. While most people recover without needing medical intervention, the flu still causes thousands of hospitalizations and deaths every year. This is why prevention and early treatment are so important. In summary, the flu is a common but potentially serious illness that can affect anyone. The best way to protect yourself and your loved ones is to get vaccinated every year, practice good hygiene, and take precautions if you or someone around you is sick. If you do contract the flu, rest, hydration, and over-the-counter medications can help manage symptoms, and antiviral medications may be prescribed for those at higher risk. Most importantly, staying home while you're sick is key to preventing the spread of the virus to others. By taking these steps, you can help keep yourself and your community healthier during flu season. Thank you for watching. If you found this video helpful, please hit that like button and subscribe to my channel. Be sure to leave a comment below if you have any topics you want covered in future videos. As always, take care of yourself and make the most of your day.